The signs appear harmless. The symptoms seem subtle. But the clock has already started ticking. And when time runs out, this may be all you can see. It is a condition called retinal detachment, and unless it is treated immediately, it will lead to vision loss and, in some cases, total blindness.
If you compare the eye to a camera, the retina is like the film of the camera, and it is attached to the back, to the wall of the eye.
And the best analogy that I can think of is comparing the eye with that of a coconut. Cut open the coconut, there's a white meat inside that is attached to the shell. The eye looks the same. We have a retina inside that is attached to another layer. So when it separates from that layer, you call it retinal detachment. And when that happens, you lose your vision.
Each part of the eye is integral to a person's ability to see. When any one of these parts fail to function properly, a person's vision may become limited or lost.
It can get peeled off totally overnight. Okay, it can get peeled off in time, in a span of weeks to months. And what causes it? A great number of diseases. Okay, it can range from simply when you're growing old, your retina weakens, you can develop some form of tear in the retina that leads to retinal detachment, to patients who are highly myopic, high grade in the eye, and the reason is that their eyes are longer than normal, so the retina is thinner than normal, very prone to tear formation and retinal detachment. To trauma, those who are involved in sports, basketball, boxing, they are very prone to retinal detachment. To patients who are diabetic, okay, diabetic patients also develop some form of retinal detachment.
Retinal detachment occurs when a part of the eye, called the retina, detaches from the blood vessels that supply it with oxygen and nutrients. Without oxygen and nutrients, the retina is unable to perform its role in the normal functioning of the eye, and the results can be catastrophic.
Okay, it was in 1996. When I woke up, I saw a round thing, a black round thing on my left eye. Parang yung you look outside, may sand, tapos you go inside the house, parang there's a black thing. Tapos, so I washed my face, inano ko yung mata ko talagang mabuti, but it was still there.
Retinal detachment is a very serious medical emergency. It can cause blindness just a few days after the first warning signs appear. These warning signs include suddenly seeing floaters, things that look like spots, hairs, or strings that float before your eyes, sudden flashes of light in one or both eyes, a sudden blur in vision, and a shadow or curtain over a part of your vision. So if you or anyone you know experience these symptoms and warning signs, do not delay. Go to an eye doctor at once. Doing so can spell the difference between total irreversible blindness and complete recovery. If treated early, there is a very good chance that a patient's sight can be saved. If treated too late, however, a patient's eyesight may be lost for good, and no amount of treatment or surgery can ever bring it back.
Told me na, Mrs. Kabungkal, you have to be operated soon. It's urgent because you have a retinal detachment. How soon is soon? I asked him. And he said, next week. So that's soon. So the next thing, nasa operating room na ako.
To diagnose retinal detachment, eye doctors conduct tests using specialized equipment.
The most important thing to do for the eye doctor is to do a dilated fundus examination, wherein we look at the entire retina, not just the back, but also the periphery, the far periphery, where we can see where if there's a problem, if there's a tear, or if there are holes in the retina that we can repair. There's no use for special test. It's direct visualization. So obviously your doctor should be knowledgeable about it. He should know what he's looking for.
Depending on the condition of a patient's retina, doctors may recommend a number of procedures.
The treatment can range from what we call pneumatic retinopexy, meaning you inject gas and you let the gas push the retinal back in place, then followed by laser treatment to patch up the hole.
If it progresses further than that, then we have to go to either scleral buckling and or pars plana vitrectomy. Scleral buckling is where we put a sort of belt around the eye to help the retina reattach. Pars plana vitrectomy is the surgery where we physically go in and take out the gel, the vitreous gel inside the eye, and reattach the retina.
Ang ginawa na, they put silicone, and after 1 year, aalisin niya he has to extract the silicone oil inside. The healing was fast, parang in a month's time. After yung monitoring niya, after yung check-up niya every week, parang I could see better. Hindi na yung light and dark. I could see more. I could see faces of people, although hindi ko makita yung mga details. Parang yung hindi na ako nadidepress. In other words, parang I felt happy. Parang so, yun.
The number of treatment options available is a testament to the many advances that have been made in the field of medical science and technology. However, the effectiveness of these procedures and the success of the treatments still depend largely on three factors. First is early detection. Having regular eye checkups can do a lot in this regard. And because retinal detachment can progress rapidly, it is important to go to an eye doctor at the appearance of any of the warning signs. Second is going to a doctor who is a retina specialist, making sure that he or she has the proper credentials and has adequate training in the treatment of retinal detachment. And third, go to a hospital equipped with the best facilities and the newest technologies. This will ensure not just accurate diagnosis and effective treatment, but also your safety.
Perhaps before, the doctors, ophthalmologists could not treat complicated retinal detachment. Nowadays, we do have the tools and the techniques to fix any retinal detachment.
But the golden rule is that it should be repaired at the soonest possible time. Because even if you repair it, if the detachment has been there for years or even months, you can repair it anatomically, meaning you can put it back in place, but functionally, vision remains poor. Okay, so the name of the game is you repair it the soonest possible time.
For best results, go to a hospital that is accredited by the JCI or Joint Commission International.
All this means is that we follow a set of standards that ensure continuous improvement in the quality of care and, more importantly, enhance patient safety.
The warning signs of retinal detachment may seem harmless. Its symptoms may be subtle, but it doesn't mean that time has run out. With your help, and thanks to many advances in technology, doctors are able to work double time to make sure that when it comes to enjoying your sight, you'll have all the time in the world.